Hello everyone and welcome back to my YouTube channel Eduimagica, the medical mystery education hub. Today we will continue our discussion on Krok 1 Pharmacology MCQs. So before beginning, make sure to subscribe and hit the bell icon. So without delay or ado, let's begin. So today we will start with the question number 101. The question number 101 states that a patient with limb fracture must be administered a depolarizing drug from the myorelaxant group for the purpose of a short-time surgery. What drug is it? This question we have discussed earlier. For this question explanation, please refer to the question number 3. We have also discussed the next question. The next question states that a patient suffering from chronic bronchitis takes a synthetic mucolytic drug that facilitates the sputum thickening. What drug is it? A patient is there who is suffering from chronic bronchitis, and the point to note here is that he has been taking a synthetic mucolytic, the drug which facilitates the sputum thinning. Now, we all know that the mucolytic drugs are divided into synthetic and enzymes. Under the synthetic drugs, we have acetylcysteine and we also have ambroxol. In the case of enzyme, we have trypsin, chymotrypsin, and ribonuclease. And in the question we have been asked that we need to give him a synthetic mucolytic. So in synthetic mucolytic we have acetylcysteine as well as ambroxol. So acetylcysteine is given in the option, so the answer is acetylcysteine. Now let's move to the next question, the question number 103. The question number 103 states that for the relief of hypertensive crisis, a doctor administered a patient a drug that, apart from antihypertensive effect, also have sedative, spasmolytic, and anticonvulsive effect. The drug was taken parenterally, and when it is taken enterally, it has laxative and the cholagogue effect. What drug is or what drug was administered? So here we must know that this magnesium sulfate, it has properties to behave as antihypertensive drug, sedative, spasmolytic, and anticonvulsive. But it also causes certain effects, such as it also acts as a laxative and cholagogue. These both increases the gastric and the intestinal motility, which helps in treatment of constipation. Okay. Now let's move to the next question. The question states that a patient with diabetes mellitus complicated by angiopathy has been recommended a drug which is a sulfonylurease derivative of the second generation. It improves microcirculation and it is known for its relatively good tolerance. So for the brief explanation of this question, please refer to the question number 53. Here in the question number 53, we have read earlier that under the oral hypoglycemic drugs, we have a class that is sulfonylurease derivative, and in that we have a drug that is known as glibenclamide. So this question is basically a direct question from the classification, because in the question the examiner gave you that this drug is basically a sulfonylurease derivative which is used for the treatment of diabetes mellitus. Okay, for the brief explanation and the classification, please refer to the question number 53. Now let's move to the next question. The next question also we have discussed earlier, and for this question you need to refer to the question number 54. Now let's move to the next question. The next question states that on the third day after the stomach resection, intestinal peristalsis wasn't restored. What drug we need to administer for stimulation of gastrointestinal tract? Now basically here we have that intestinal peristalsis is not restored. So to restore that, we can use drug that is the MNN cholinergic, and the best drug which is used for restoring the intestinal peristalsis, that is none other than prozerine. It is basically a indirect acting MNN cholinergic. Now this drug basically does not act on the receptor directly. So what this drug does, this drug basically breaks the acetylcholine esterase. Now once acetylcholine esterase reduced, they lead to the increase in the acetylcholine in the synaptic cleft, which leads to the stimulation of nerve ending and leads to constriction. Okay, this was all about this question. Now let's move to the next question. Question number 107. A stomatologist injected a patient with a certain drug in order to reduce salivation during tooth filling. What drug is it? So in the question it is given that a stomatologist basically injected a patient with a drug in order to reduce the salivation during tooth filling. So to reduce the salivation, we can use a drug that will basically blocks the muscarinic receptors. Now when the drug will basically block the muscarinic receptor, that will lead to the decrease in the secretion of GLT. So Among these options, we have atropine sulfate, and atropine sulfate is basically a both centrally acting and peripherally acting muscarinic blocker. Okay, now let's move to the next question, the question number 108. A patient with chronic cardiac insufficiency has been taking foxglove, that is basically digitalis, for a long time. Due to the violation of intake schedule, the woman got symptoms of intoxication. These symptoms result from this question also we have discussed earlier that a patient is basically taking a drug. As he is taking the drug for a long time, that resulted in the disturbance of the intake schedule, and the woman got the symptom of intoxication. So basically the patient got toxicity with the presence of drug. So it is basically a material accumulation, and you must know that material accumulation is commonly seen with digitalis group, and functional, we have another, that is the functional accumulation or functional accumulation is basically seen with antidepressants. It is basically seen with antidepressants. Okay, now let's move to the next question, the question number 109. This question basically states that during local anesthetization, the patient has gone into anaphylactic shock. What drug must be administered to the patient? So the point to note here is that patient has been suffering from anaphylactic shock, and in the case of the anaphylactic shock, the first aid treatment is basically the use of epinephrine. Epinephrine. What this epinephrine does? This epinephrine basically stimulates the alpha receptor, and when it stimulates the alpha adrenoreceptors, this basically increases the peripheral vascular resistance. Peripheral vascular resistance. Now, when the peripheral vascular resistance increase, it basically improve the blood pressure and the coronary perfusion. Improves blood pressure and coronary perfusion, and it also helps in reversing the peripheral vasodilation. How? Because epinephrine causes the vasoconstriction, and in the case of the bronchus, it leads to dilation. Thus, the anaphylactic shock is being treated, and they basically decreases the angioedema. Okay, so the answer is epinephrine hydrochloride. Now the next question states that before tooth extraction, a patient was advised to take a certain drug for hemorrhage prevention. What drug was advised? So basically, for hemorrhage prevention, we will take coagulants. Okay. And these coagulants are basically divided into three main groups. We have direct acting, we have indirect acting, and we also have drugs which has other mechanism of action. Now, the direct acting drugs, they are active in vivo and in vitro, whereas indirect, they are active only in vivo. Okay. Under the direct acting, we have drugs such as thrombin, fibrinogen. We also have calcium chloride. In the case of indirect acting, we have vicasolum or vicasol, and in the other we have atamesylate. Okay, so among these we can use vicasolum. Now let's move to the next question, the question number 111. This question also we have discussed earlier, so I am not discussing this question here. Okay, and the question number 112, you can refer to the very first question of the base. There it was amoebic dysentery, and I have already told you that in the case of the amoebic dysentery we will give patient metronidazole, that is basically a drug of choice. And in this question it is basically given that the causative agent is anaerobe, so the drug of choice will be same, it will be metronidazole. Now let's move to the next question. The next question is, a 45-year-old patient suffers from neurosis characterized by irritability, sleepiness, and motiveless anxiety. What drug would eliminate all these symptoms? So, the drug which will eliminate all these symptoms will be benzodiazepines. These benzodiazepine drugs basically acts on benzodiazepine receptor, and they are GABAergic, which will increase the inhibition of central nervous system. So the drug under benzodiazepine are nitrazepam and diazepam, and we have diazepam in the option, so the answer is diazepam. Now let's move to the next question, the question number 114. In this question, a 12-year-old child has intolerance to some foodstuffs. Their consumption causes an allergic reaction in form of itching skin eruptions. What antihistaminic drug should be administered so that the child could attend school? Here they are saying that what drug we can administer so that the child can attend the school. So for this question also you can refer the, I think, second or the third question in the very first video, because loratadine is basically the drug which does not crosses the blood-brain barrier, and when it will not cross the blood-brain barrier it will not cause sedation, and the child could attend class. Okay, and these are basically second generation antihistaminic drugs. Now let's move to the next question. A patient that entered the admission office had the following signs of acute cardiac insufficiency: paleness, acrocyanosis, and frequent shallow respiration. What drug is indicated in this case? I've told you earlier uh, in previous videos where I told you about the digitalis groups and the strophanthus group. There I told you that in Krok, whenever you will be asked about the acute cardiac insufficiency or acute right ventricular insufficiency or acute left ventricular insufficiency or acute heart failure, you will look for the drug that is corglycum. Whereas in the case of chronic, you will look for digitoxin or digoxin. Okay. Now let's move to the next question. The next question is: a patient with myocardial infarction was admitted to the cardiologic department. For pain relief, it was decided to potentiate phenylated action with a neuroleptic. Which of the following neuroleptic is the most suitable for neurolept analgesia? So basically, the neurolept analgesia is a kind of general anesthesia. It is a kind of general anesthesia. It is a kind of general anesthesia when the neuroleptic, that is basically droperidol and narcotic, that is basically phenylated analgesic, are administered together. They basically produces a synergic action, or you can say that when phenylated is given with droperidol, then they basically produces a synergic action, that is they basically produce psychic suppression, and this droperidol produces the psychic suppression, whereas the fentanyl basically decrease the pain, or you can say that the fentanyl abolish the pain and droperidol basically suppresses the psychic condition. And when these both the drugs are administered together or they are co-administered, they basically show the synergic action. Okay, this was all about the neurolept analgesia. Now let's move to the next question, the question number 117. This question also we have discussed earlier, and for this question you need to refer to the question number 47. Now let's move to the next question, the question number 118. A patient has herpetic rash. What medication should be administered? We all know that herpetic rash is basically caused by the herpes simplex virus. And for the herpes simplex virus and for the cotrimazole, cytomegaloy, and for Epstein-Barr, the drug of choice is basically acylover. This acylover This acylover is best known for the treatment of herpes simplex, and the acylover is basically a synthetic purine purine nucleoside analog. Okay, now let's talk about the mechanism of action of acylover. The mechanism of action states that acylover basically the acylover basically transforms into the triphosphate, and it interferes with the viral DNA polymerase, and which leads to the inhibition or decrease in the viral DNA replication. Okay, and you need to note a point over here that acylover basically only inhibits the active replicating virus. Acylover inhibit active replicating virus. Now let's move to the next question. The question number 119. A patient who has been treated in a neural clinic has been taking a sedative for a long time, and he got following complications such as cough, rhinitis, and epiphora. Now basically we have sedatives over here. Sedatives are basically the drugs which are used to treat restlessness and light form of anxiety, used for the treatment of restlessness and anxiety. That is basically a light form of anxiety. Now these sedatives are basically divided into four groups. We have non-organic preparations, we have vegetable preparations, we have metabolic sedatives, and we have combined preparations. In the non-organic, we have sodium bromide, and we also have potassium bromide. In the case of vegetable preparation, tincture from tincture from valerian, and we have tincture from linoneurum. In the metabolic sedative, we have melatonin, and in the combined preparation, we have corvalol and percin. Now let's talk about the mechanism of action of sodium bromide, because from the options you can see that only sodium bromide is the sedative which is given in options, and this sodium bromide you can also think by the side effects, because the side effects such as cough, rhinitis, watery eyes, which is also known as epiphora, and skin rash are basically caused by the sodium bromide. Now, how this sodium bromides act? Now, let's talk about a bit about the mechanism of action of sodium bromide. Okay, the sodium bromide basically increases the inhibition of central nervous system, and when the inhibition of the central nervous system is increased, it also results in treatment of patient anxiety. Okay, and the effective dose the effective dose of sodium bromide, it depends on the higher nervous system activity. It depends on the higher nervous system activity from person to person. Okay, this was about all about the sedatives, and this question number 119. The next question, the question number 120, we have discussed earlier. The question number 121 also we have discussed earlier, because if we will inhibit the COX-1, the COX-1 basically helps in prevention of stomach mucosa from HCl, and when the COX-1 will not be there, then it will increase the condition of gastric ulcer. We have discussed this question earlier in previous questions very briefly, so I am not discussing it here. Now let's move to the next question. The next question is a direct question. In this question, they will ask you that narcotic analgesics have the following receptors. So narcotic analgesics are also known as the opioid analgesics, and they have the receptors on which they act, and their functions takes place, or basically their uh, effect take place, and these receptors are known as opiate receptors. So you need to remember this question directly, that the narcotic analgesics or the opioid analgesics have the opiate receptors, and for the androgens, I've told you earlier that we have nuclear receptors. Okay, now let's move to the next question. A patient with hypertensive crisis was admitted to the cardiological department. He was injected intravenously with an antihypertensive drug, which is a salt of an alkaline earth metal. Now, among these, which is the salt of alkaline earth metal? It is magnesium sulfate. This question is also a direct question. And the question number 124, I told you earlier that the antidote for the morphine is naloxone. Okay, and antidote for the methanol is ethanol. Now let's move to the next question, the question number 126. The question states that an 8 to week pregnant woman with acute respiratory disease and temperature rise up to 39 degrees Celsius has called in doctor. The doctor insisted on her avoiding taking paracetamol because in this period of pregnancy there is a risk of. So, while taking paracetamol during first trimester, there is a risk of underdeveloped, or you can also say that abnormal fetal development. Underdeveloped fetal or abnormal fetal development. It acts due to the taking of certain drugs. It can be paracetamol, it can be doxycycline, or it can be another antibiotics or the broad spectrum antibiotics. These drugs basically can cross the placental membrane and acts on the fetus directly. Okay, now let's move to the next question. The next question is, a pneumonia patient has been administered acetylcysteine as a part of complex therapy. What principle of therapy has been taken into consideration? So, we are giving patient acetylcysteine as a complex therapy, and under which disease? Under pneumonia. So why I'm giving this? I'm giving this because in pneumonia the patient may be having what? A wet cough or mucus. So I need a mucolytic drug. And what this type of therapy is known as? This type of therapy is known as pathogenetic, where we study the cause and enzymatic and genetic role. Okay, this was all about the question number 127. And the next question, 128 question, is also a direct question. In that, you have been asked that a 26-year-old female patient with bronchitis had been administered a broad spectrum antibiotic as a casual treatment drug. Specify the drug. So the broad spectrum antibiotic among the following is none other than doxycycline. Now let's move to the next question. The next question is also a direct question. I have told you earlier in the previous question where we have talked about the antihypertensive drugs. I told you there that under the calcium channel blockers we have amlodipine. Okay. Now let's move to the last question. The last question states that administration of doxycycline hydrochloride caused an imbalance of the symbiotic intestinal microflora. Specify the kind of imbalance. So whenever we take antibiotics, these antibiotics basically kills the microflora of the intestine, and this condition is known as dysbacteriosis. Dys means disturbance and bacteriosis means that is microflora. Okay, this was all about the Pharmacology Krok Base 2014. Hope this video on the Pharmacology Krok Base helped you, and please, if you want to hear from me again and if you have enjoyed this video, then please be sure to hit that subscribe button before you go, and please don't forget to like, share and comment, and let me know your suggestions on Instagram. Thank you for watching. नमस्ते, फिर मिलेंगे।